I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, Naturopathic Doctor. Okay, welcome back to another episode of Women's Health Unplugged. I am so fortunate to be joined today by Dr. Nikole MacLellen. She is a naturopathic doctor in Nova Scotia. We have become Instagram friends, her and I, partly just for our love of training and sport and evidence-based medicine in the world of female physiology and sport. I am so grateful that you said that you would be on this show, Nikole.
Yeah, thanks for having me. This is great.
So the topic we chose to discuss today, and something that you are so well versed in, and think has it's a bigger, or it should be a bigger conversation than it is right now, is around the impact of concussion on female health, female physiology. Can you just give us a bit of a background for how you even got to this place as being such a sport-focused naturopathic doctor, which I think we often see a lot of male naturopathic doctors go towards performance and sport and working for sports teams. I love seeing a strong female physician working in female sport. Tell me how you kind of got to this place to be such a sport-focused ND.
Sure. Yeah. So growing up, sports were my everything, essentially. I think I was at the hockey rink probably 7 nights a week and at least 2 ice times. So I played ringette, I played hockey, I played soccer, I played volleyball. And yeah, sports essentially were my life growing up. And then I started at Dalhousie University for business. So initially, my dad kind of made me this deal that if I went to business school, he'd pay for art school on the other side of things. So, young, just wanted to be an artist and kind of live that life. But it turns out life is difficult sometimes for artists. So it was a good move on his part to push me into business first. And then when I completed business, I knew I couldn't sit behind a desk. I knew nothing that I was learning really appealed to me except for probably the entrepreneurship part of things. So I kind of went back to the drawing board and was like, well, what do I want to do with my life, essentially? And then my mom had always been into health and nutrition. We only pretty well saw naturopathic doctors growing up. And worst case scenario would be, the hospital or, I don't know, a walk-in clinic or something. And so I thought about nutrition, and I was always into food. So I did dietetics. And then with dietetics, I was in long-term care facilities or rehabilitation facilities, handing out Canada's old food guide, which was horrid, as you know, to double leg amputees from diabetes complications. And I'm like, we're too late here. We missed the boat here. And one of my placements in a community setting was with a QMJHL hockey team. And we were doing so much work with the boys to optimize nutrition and optimize performance and making sure they're hydrated. And that is where I thrived and was shining. I'd get up every day so excited to work with them. And I think it's ever so slightly a bit of a cop out on my end, because I like patients who are ready to perform, and they buy into what I say. They already are chomping at the bit to get the next piece of information. Whereas from my experience with dietetics, sometimes it's pulling teeth to get change to happen. So that's kind of the route that I wanted to take. And then with all of I feel we missed people a little bit too late on the dietetics train. And there's some dietitians that are amazing in preventative care, obviously. So maybe it just wasn't what I was doing. So then I went to the Canadian College of Naturopathic Medicine, and I got heavy into fertility there. I was super interested in fertility, and I had always had my love of sports. So I was like, should you try something new? Should you expand your horizons a bit? But I didn't get the fertility shift, and I did get the sports med shift. So I was like, all right, the world is just telling me to do my thing and go after it. So thank goodness it did, because it's just, I love it so much. And when I finished at CCNM, I did an additional residency to learn all of like the regenerative injection therapies and IV therapy, and just pretty focused heavily all of my research on anything sports medicine intervention wise. And then I got picked up by a sports medicine clinic here. One of the guys who started it is probably one of the best known sports chiropractors out in Atlantic, Canada. And he put together a pretty amazing team of practitioners specific to sport. And that doesn't mean we only see sports, but it's just kind of like the ideal population that we would work with. And like throughout the way I've worked with NHL athletes, like AHL guys, I've just been talking a lot to the UFC Performance Center, and we've been trying to get some stuff going there. So all of these, the universe just keeps throwing sports in my lap and I keep running with it. So that's kind of how I got here for sure.
That's so cool. That's such a great story. I love, like, it's interesting what you say, like, about that sort of like self-motivation when the goal is performance, right? Although I think when sometimes like we've researched athletes to death, right? And sometimes in certain circumstances, we haven't researched our weekend warriors or our sort of, I was using air quotes, like our average patients. But so much of the literature from athletes can be applied to the general population, right? Even when we're thinking about things like hydration status and fueling and all of that, like those are still like really relevant things to talk about with the public. But you're so right that when your body is your job, or when you need to be able to rely on yourself like that, like working with athletes is such a cool population.
Yeah, definitely. And I'll go in to talk to like groups of CrossFitters or whatever, like weekend warrior type athletes. And when I explain athletes, like I'm including them, you know, they have a full-time job. They're training like 6 days a week. They're eating like athletes. They're everything about what they're doing is comparable to kind of what we would perceive as an athlete. So why wouldn't we put them in that category too, right?
Mm-hmm, mm-hmm. So not getting that fertility shift was maybe sort of a good move career-wise.
Yeah.
Although I want to bring that conversation back to like talking about concussion and hormones, and because that's often where it shows up in my life, right? Is women having sort of hormone imbalances that maybe can be sort of brought back to sport. So what is it specifically about concussion that you're so passionate about? Like help our listeners kind of understand why this is such an important topic for us to have, like in the context of women's health.
Yeah. So for me, like I've sustained 4 or 5 pretty big ones. And I think it took me a really long time to figure out that that's what was the discrepancy for a lot of things. So we'll probably get into this, but I found myself in that fight or flight state most of the time, despite being a pretty chill person. Like weird things would bring up anxiety. I couldn't remember words that often. I had horrible periods. And I can't always call it a direct correlation between hitting my head and having horrible hormonal symptoms, but the timing kind of matches up a little bit as well. So I think for me, anything that I can figure out to start to find my words again and to have great conversations like this where you don't seem slow or you don't seem like you don't know what you're talking about because you can't find that word right away. And then the self-esteem that goes along with it too, being able to find your words, being able to use them appropriately, and your body just functioning probably the way it's supposed to, but you just didn't know how far off the mark you were before. And then the more I see too, treating specifically female and female hormones and female athletes is there's no research. There's nothing out there. There's barely anything that shows us what's going on and what's going on if you're on birth control and what's happening if you're at a certain phase of your cycle and you get hit versus another phase, you know, and all of these have pretty impactful outcomes for how to optimize performance. And I think they're being skipped over in the literature a lot. So I think, yeah, it's just anyone advocating for this. And I know you just had Stacey Sims on, who is like the godmother, I guess I would say, in all this.
Yeah.
It's cool. And just my past experience and how there was nothing. Like they told me to go into a dark room and try not to hit my head again. And for me, like that wasn't an option. I'm going to get right back out and play hockey and all that sort of stuff. So had I had known potentially what I know now, maybe I would have done things differently. But hindsight's always 20/20, right?
Yeah. And I know over the years, there's maybe been some criticisms of some of that return to play guidelines. And I even know, like, even from my own kids' experience, that we maybe are going overboard's not the right word, because we always want to be safe. But, my daughter once tripped in the hallway at a camp, and it initiated a massive concussion protocol that meant she couldn't return to camp. She was 6, right? Like 6-year-olds fall. So I think over the years, we've had like lots of criticism about some of those return to play guidelines, but I'm not sure that we're completely hitting the nail on the head as far as assessment and figuring out like what our actual standards should be for assessing people around concussion. Because we see patients many, many weeks out still having issues. Like, what kind of guidelines should we be following right now? Or what are sort of our best resources? What should people be looking out for when we're talking about like concussion and concussion symptoms?
For sure. I think it changes, or the new research comes out monthly of what best practices are. But resources like even Vital Link, the magazine that the Naturopathic Board sends out, like I wrote an article in there about like the foundational approaches. So say you knew nothing about it, and you had a patient come in with a concussion, this is a beautiful start, So that's a good one. There's a guy on Instagram, Concussion. He has the concussion management course. So if you get trained through them, then you're a concussion practitioner. So even baseline information like that. But I think like on top of that is doing your own research, because there's so many gold mines of information that you can find just starting to like break these things down. And when you really break them down at the end of the day, they're not revolutionary concepts. So like inflammation, we understand what inflammation is, right? And we could infer how detrimental that could be to brain health, right? Especially chronic or long-term. And we know what the HPA axis is, or the kind of the stress axis. If that's turned on long-term, we can see downstream effects from that. So really meeting the patient where they're at. So if it's very specifically a sleep issue, then go after sleep and try to find the root cause of that. We don't always have to be like, oh, this whole cascade of things is happening all at once. Maybe they're only presenting with pieces of post-concussion syndrome, And then on top of that too, like, you can sandbag baseline testing, right? And there's some pretty good research that athletes are doing that. So these are not great resources to say what's happening. Maybe if we had a baseline and then a follow-up post head trauma, but athletes are too smart for that. They want to get out to play, and they're going to change their answers based on that,
So by sandbag, you mean like they're not performing at their best before, like when their baseline being assessed, so that when they do get concussed, they don't look so bad. Is that what you're saying?
Exactly. Yeah.
Yikes.
Yeah. So it's, and I get it. Like one of the hardest parts of my job is to tell an athlete to slow down or relax, or, heaven forbid you had to miss a game. And I understand how that feels, but it's also like, there's a long-term end to this too, right?
Yeah. And that's probably the part, I think, when we think about concussion management, that's the part that we maybe have de-emphasized the most, right? Like if you ask patients, like, what are the symptoms of concussion? They would probably say, oh, headache, foggy thinking, tired, we have to lie down. But if you ask them like what the post-concussion symptoms can look like, they don't know, right? Mm-hmm. So like, what are the top sort of long-term symptoms and side effects of concussion that you typically see that patients are amazed that it's even like connected to their head injury?
Yeah. I think one of the big things is potentially they connected to a head injury, but don't know if there's anything they can do about it. So like slowed brain function, and that word recall becomes a big one. Concentration is huge. You read the same thing over and over again and can't remember what you read in the book or something like that. Another huge one is GI dysfunction that people don't always associate with concussion management. But if we think about it, that vagal nerve is that superhighway from our brain to our gut. And if we've slowed our brain down, then there's assumption that vagus nerve is going to be slowed as well. Or if it's kind of stuck in that fight or flight state, we're going to notice GI symptoms with that too, right?
I never would have thought of that one, but you're like, that makes perfect sense.
Definitely. And then kind of if our brain is inflamed, I just read a paper the other day, 2019 paper on the perpetual being stuck in the fight or flight response, the chronic inflammatory state that leaves our brain in. And if you think about your brain being inflamed, then all of the hormonal processes are probably going to be impacted by that, right? So we're almost looking at like a third or fourth stage concussion of hypopituitarism, or low pituitary function, essentially. And the pituitary is the release of all of our telling what our hormones to do, essentially, in the body. So if that's not working optimally, you can imagine the dysfunction that we would see.
Yeah. And so when we're thinking like back specifically around like women's health, that's where I always find I can shock patients about the impact that their concussion has maybe had on their hormonal health, is that it actually can cause cycle disruption or change like things about their sex hormones that will maybe influence their fertility, but often show up as like cycle irregularity or changes to the way they're experiencing their hormones because of that change. What do you typically see? How do you see it sort of typically showing up for women as far as hormone dysfunction?
Yeah, a lot of emotional dysregulation, kind of PMS type symptoms. And again, it's really hard to correlate to say like, oh, you hit your head and then 3 years later, this is why this is happening. But if we can always break it back down, it's probably that perpetual stress response that then impacts the hormonal cascade. And if we never addressed being stuck in fight or flight, then we're never going to see it resolve. So then we start to see, more painful periods, heavier flow, irregularity of the period. So sometimes some months it comes and some months it doesn't. So anything that could essentially go wrong on that front can go wrong. And in the Journal of Women's Health, there was kind of a more recent study that showed of participants, of 104 participants, there was 68% post-concussion that had irregular menses and mental health issues. So definitely the research is backing up kind of what we're saying here.
Yeah, it's so important. And I mean, one of the things I think we generally don't do well is assessing women's health or women's mental health against their cycle, right? And I think it kind of goes both ways. Either we call everything PMS, or we forget to call things PMS, mostly because women don't really think to track their mood against their menstrual cycle. But when they're having that much dysfunction, meaning that like if their period's showing up on day 18, or maybe they go 40 days without a period, those anovulatory cycles are a huge risk for just low mood in general, right? Like aside from their concussion, low mood, just not having good female hormone production is going to increase their risk of having low mood anyways, right?
Yeah. Our period is such a great indicator. A healthy period is a healthy body, right? And even like layered on top of that, people taking birth control, like we're leaving our performance on the table, as Stacey always says. And I never like to tell a woman what to do, but I think it's a massive amount of education that has to happen to show that there's ways around painful periods that don't have to be birth control. And unfortunately, kind of in Western medicine, it seems like a one size fits all for any sort of period dysfunction, right?
Yeah. And I think when we were talking about this a little bit like off mic before we started, but some of like our bigger picture issues when it comes to concussion is like, we want young women to stay in sport, right?
Mm-hmm.
B, them staying in sport during those menstrual years or those like pubertal years where they're having so much change in their body is difficult. There's a high dropout rate in sport for women as they transition through puberty. That's also maybe where they're playing at their highest level and starting to have like their highest risk of head injury due to their sport. And that's also when they start to have emergence of other hormonal issues that we often solve with the pill. So whether it's PCOS or if they have overtraining, underfueling, amenorrhea, right, or loss of their menstrual cycle. Now we've got all of those things happening at the same time, right? We've got concussion, we've got just normal development, and then we've got us maybe layering the oral contraceptive on top of all of that. It makes it a bit of an assessment nightmare to figure out what's causing what.
100% it does. And I think like the beauty of naturopathic medicine or any practitioner that gets to spend time with their patient is really siphoning out those situations to say like, okay, despite all of this chaos that's going on, what are foundationally the symptoms that you're having? And then do a really great assessment based on that and a treatment plan that could assess the root cause. And I think we get knocked a lot in naturopathic medicine for not being evidence-based, but like the research is there, right? It's just a matter of what tools we use to intervene with it. And I think we have a lot of tools in our toolbox to be able to impact concussion significantly and specifically in women.
So what does that look like when you're like starting to support women? I know we're not giving medical advice as we chat about this, but mostly I want you to give people some hope, right? Because, and I think in my experience, sometimes patients don't know that their concussion has been part of their hormonal dysfunction. The other side of the coin is patients will say, well, I haven't been well since my concussion 3 years ago, and now there's nothing I can do. Like what are our emerging therapies that people should be having a conversation with their practitioner about?
Yeah, I think step one is practitioners asking the question, did you hit your head recently? And I always ask that question at the end of an appointment. Has there ever been a time in your life that you've never felt well since essentially? And people are hesitant, or I'm like, do you ever fall out of a tree when you were a kid? Did this ever happen? Did this ever line up with, so being super inquisitive, I think, is step one for all practitioners to start to do. And I think naturopaths do a pretty good job of that. And there's, the whole team that I work with, they're so inquisitive to the point where like people are like, oh, you can write a book on us now, and that's a good thing. But emerging treatments, like every new paper that I read, there's so much stuff on military research from blast trauma and stuff like that. So I'll find one paper on like alpha GPC, which we'll see the choline part of that is really good for the neuronal connection, which would be huge for women because we know we use our brains differently than men, right? So instead of going A to B, we kind of go A, C, B, A, to get the answers. And it's just like the two hemispheres interlink that way. So if there's a swelling, we're not connecting the two hemispheres as well. So we could see even greater disconnect there for women. Another thing too is like there's all the baseline treatments that would be the same, fish oils, anything to reduce inflammation. But when we start to see period dysfunction, then we really have to assess, is it coming from which part of the HPA axis is it coming from? The brain, the adrenal glands, or or the ovaries. So I think like there's just so much of the assessment piece that really has to be addressed. And a lot of it is just forgone there's tons of stuff we can do for brain health, but what about like systemic health,
Mm-hmm, mm-hmm. And is there any research about like baseline health and how patients are going to recover and fare from concussion? I haven't spent any time looking at that, but like let's say athletes have not had a concussion, are there things they can do or that they should be focusing on as far as their baseline health so that they would recover better?
Yeah. So some of the research, specifically for women, neck strength, actually for men too, neck strength is a huge indicator. Like if you can see the hit happening and you can control this motion, because oftentimes we think of a concussion as hitting our head and getting a bruise to our brain, but that's not what's happening at all. So just an extreme whiplash could give you a concussion because it's just the shearing between the axons that is the real issue. And then the progression from there is we see our brain trying to protect itself. So it releases a bunch of neurotransmitters and cytokines, which cause inflammation with the whole goal of protection. But that's the same as any chronic inflammation, right? Acute inflammation, good. Chronic inflammation, it starts to wear away at the tissue, right? So the same thing is happening in the brain. So the first few steps would always be reduce inflammation, try to mitigate any metabolic damage, and then kind of to specify it just is how they present. So if it's sleep issues, then we have so many tools of the trade to fix sleep, right? And if it is sleep issues and hormonal issues, maybe it's a higher up adrenal issue because then we're affecting melatonin and then we're affecting estrogen and progesterone as well. So just really figuring out where the issue is starting from is huge on top of just trying to mitigate the inflammation in the brain.
That made me think of like, are there any conventional treatments that you see patients put on that are harmful? Right? Like I'm starting to think about like the way that people present at their doctor's office with disturbed sleep or with depression. And some of these treatment options that people are getting are affecting their nervous system. Do we know that? Do we know if there's any treatments that if we apply it in the face of concussion that patients are going to have poorer outcomes? I mean, the answer might be no, but are there any things that you find that people are going down like the wrong path or they are being over medicated? Like, do you have any thoughts about that?
Definitely. I think like on a hormonal cascade, and I would say this is for men and women, like say if we derive that, progesterone is an issue or testosterone is an issue, and you start giving that hormone replacement, but it's actually an adrenal dysfunction causing hormonal issues, then we never fix the problem, right? So we're just giving you, we're just trying to fill up a pool with like a bucket with a hole in it. So I think really determining where the issues arise is huge. In my personal opinion, I don't know who else feels this way, but I think we overdose melatonin to exhaustion. Our pineal gland only releases 0.3 micrograms, and people are walking around with like 5 milligram, 10 milligram doses. So if we're trying to mimic the natural sleep cycles, I don't think that's the way to do it. I see a lot of people just throwing out melatonin or throwing out things that they've heard could work, and even like creatine is a huge one for concussions, but we see benefit with creatine if you're deficient in creatine. So, and then a lot of like mental health stuff, is it depression or is it testosterone is low due to long-term stress on the system? And that's what the issue is. And then we give an antidepressant and potentially could change neurotransmitters to make things worse.
So it all comes down to assessment, which is like my whole shtick with patients too.
Oh,
that like, and progesterone, that's such a great example because that comes up often, right? That patients will go for lab work and they'll come back as having, again, in air quotes, progesterone deficiency when what that actually means is that you are anovulatory, right? You didn't ovulate. And what that actually means, right, is that there's a process happening way further up than just that last step of a 1,000-step process, right? And so it sounds like from a concussion perspective, like we're kind of, having the same conversation where we may have changes to end organ hormones, whether it's estrogen or progesterone, or for the men, maybe testosterone. But to get the real solution, we probably need to backtrack and figure out what's going on versus treating that last step, right? And maybe that's not wrong to treat the last step if it gives patients like some kind of relief. Mm-hmm. But I think, and at least in my experience, that doesn't usually solve the whole problem, right?
Definitely. And it's always that root cause approach. So if we give this, what do we get out of it? Do you get out of bed now and do you function in society and can you control your temper? Awesome. That's great. Now we got you this far. Can we get you to work out again? And can we get you like good nutritional habits? So I see so much value in anything that improves life for a matter of time. But if it's medications that potentially have detrimental side effects, then always have an exit strategy for them, right?
Mm-hmm. And what does like the timeline look like? So if patients have had a concussion, they've maybe recovered and had returned to their sport, whatever that is, but they have some long-term symptoms. When they start working with you, like what should their expectations look like around recovery?
Mm-hmm. I think it's extremely individualized and to the degree of which your state was before you hit your head, and just kind of how your body works in general. So I don't think it really matters of how hard you hit your head or if you lose consciousness or anything like that, but it's really about those metabolic internal processes that are happening. So I would say up to 52 weeks, we can still see nerve cells in people's brains are on high alert. And that's obviously dependent on the person, but that's a long time, right? To just still be in inflammation phase. So we have that. And then some people will like smoke their head and be fine in 2 days. So I think it's really a lot more of like what gets hit maybe, or what the state of the brain was to begin with. And then again, coming back to that assessment piece, hopefully we're asking the right questions initially, because if I don't address the right thing, then the healing protocol is going to take longer.
Mm-hmm, mm-hmm. So like from being on a mini soapbox here, like what's your big message for women and around like concussion, women's health, women's hormones? Like, what do you want the world of female athletes and weekend warriors and women who are starting to embark on sport? Like, what do you want them to know?
Definitely. So many things.
I know. But what's your passion? Like, why do you do this? Right? Like what gets you out of bed in the morning?
Definitely. My why is always education, and we become empowered when we know more, right? So forever, and I did it too, I always put any medical professional on a pedestal and assumed that they knew what they were talking about and assumed that they knew more than I did. And for the most part, they probably do, or have some sort of understanding of things. But I think it's also really good to do your own research. And I know we're very busy and we have our own life, and you have to essentially leave it up to the medical professionals to guide you. But I think the more you know and the more you ask questions and the more reputable sources you get information from will do you a world of good, A, to ask the right questions, and to B, to mention the right things, you know?
Awesome. Yeah, I think that that's such a great message, right? It's that like, to be like, and this is kind of when I think about what our purpose of the podcast is really about helping women get better access to information so that they can advocate for the kind of healthcare that they need, right? It's not a coincidence that you don't feel well since your concussion, right? And there's things that you can do about it that change it. I think the biggest gap in knowledge that I see around concussion is just the potential impact on female hormones. And that's, clouded by women using the pill or having an IUD, or maybe not being particularly in tune with what's going on with their cycle. So maybe they don't know things have changed because it's being masked somehow. Or it's getting chalked up to, like, we'll call it an end organ issue, meaning we're calling it an ovary problem when it's really like an upstairs problem and it's a brain problem. It's very common, I think, for women to get dismissed and misdiagnosed as having some kind of female hormonal imbalance when we maybe can track it back to her life as an athlete, and at least assess her properly so we have a better understanding of what's going on, right?
Definitely. And I think, like, for women, be confident. Like, if you guys know your body better than any practitioner will ever know your body. If it feels wrong, there's likely that there's something going on, and not to be like in a hypochondriac sense, but honestly, like, your internal processes. The other thing on top of that too is, like, we're kind of horrible rememberers of what's happening. So I really suggest that people write things down. And if there is some sort of dysfunction, like, for example, is it showing up, every time you play a sport, and that's when symptoms get worse, then we're talking about potential, heart rate variability stuff, and maybe your brain hasn't acclimatized to the new norm. So there's so many things that we can do. And the more information you bring me, the way better treatment plan we can put together for you.
Yes. Yeah. That makes such a big difference. It's interesting. There's some research to say that we all remember our last period as being the worst ever.
100%. That's such an accurate statement. Yeah.
And so our recall is terrible. Like, whether, patients have sustained a head injury or not, our recall on our symptoms is really not that great. So yes, the best thing that women can do, like when they're going to have a conversation with their practitioners, to track some of these things, right? Because it gives you so much information.
Definitely.
How can people get more connected with you? You made a mention of an article you've written and whatnot. Like, how can people connect a little bit more with what you do and online and whatnot?
Yeah, I'm pretty well an open book on Instagram. It seems to be like, I share everything on Facebook too, but Instagram is where I share all of my knowledge, and it's heavily, pushed towards female athletics. And again, when I say athletes, I mean weekend warriors. I mean anyone kind of in that trying to be better realm, essentially. So I'm at sports.cokes on Instagram. And then, research wise, like, I don't really like sitting down and writing articles, so I love the little tidbits that I can throw out. And also, like, message me. I know there's some limitations on who I can treat and when I can treat them, but if there's something that I can do for you, or find a practitioner that knows what they're talking about, I'm by all means ready to share as much as I can.
Awesome. And you have a podcast.
I do, yes. I forgot about that.
How can we listen?
Yeah, so it's on iTunes and Google Play, and it's called the OffSeason. And it just kind of, like, growing up, my favorite type of books were athlete autobiographies. Like, Open by Andre Agassi is my favorite book ever. And I think it's amazing what athletes go through. And I think the more I get to talk to them, the more dysfunction and overcoming that we can see of things. So it kind of just really highlights to me again what the issues are, what people are noticing. So yeah, it's the OffSeason on iTunes.
Awesome. Thanks so much for having this conversation with me, Nikole.
Yeah, anytime. I love this stuff.
Yeah, I totally appreciate your expertise, and thank you for sharing.
No problem. Anytime.
I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health.
Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.